This video will demonstrate the use of a closed inline suction system for tracheostomy patients. All tracheostomy care is aerosol generating, and suctioning has a high risk of staph exposure. The use of a closed system will help to reduce the risk of staph exposure. Only undertake suctioning where clinically indicated, and encourage your patient to cough and clear independently if at all possible. You'll need the suction system. It comes complete with a tracheostomy length tube. These are available in two sizes, 12 and 14, and the size 12 is suitable for most adult tracheostomy tubes. It also comes with stickers for days of the week that will indicate when you next need to change the tube, and they're good for 3 days or 72 hours. The catheter mount can be disposed of, it's not needed. Along with the suction catheter, you will need a filter. We've chosen a paediatric size filter as it's not quite so heavy. If we look at details of the catheter itself, you have the port at which you attach to the tracheostomy. You have an exhale port where we will fit the inline filter. We have a flush line for cleaning the catheter after use. The catheter itself is within a plastic sheath, and it has centimetre markings along its length to help indicate the depth of suction. We attach this end to the suction apparatus, and suction is started and stopped by depressing and releasing the blue cap. When we pass the catheter, the first 10 centimetres or so is within the dead space at the top of the kit. When we pass on down through into the airway, we still aim at the same suction depth as with standard suction, and be careful to withdraw the sheath back so that it doesn't restrict the catheter movement. And generally you will look to a depth of about 20 centimetres in total. When we withdraw the catheter, we straighten, depress the cap to apply suction, and withdraw the catheter in one continuous smooth action. You have up to 10 seconds to withdraw the catheter. It's really important that the catheter is fully removed from the airway, and there's a black marker at the end of the catheter that needs to be visible within the plastic sheath when it's fully withdrawn from the airway. After use, you can fix a syringe of saline to this flush port and apply the suction to clean the catheter between use. If your patient is unable to clear secretions themselves and you need to suction, only put this in place when you're suctioning the patient. It's quite heavy and can risk dislodging the tracheostomy tube if it was to be left in place. Swap the oxygen mask for the suction apparatus, attach onto the catheter, and with appropriate monitoring, support the apparatus whilst passing the suction catheter into the airway to the required depth. Apply the suction and withdraw in one smooth action over about 10 seconds. Make sure you fully withdraw the catheter, and when complete, you can put a saline flush through the flush line while suctioning here at the same time. That can then be removed from the patient and the oxygen mask replaced. Some areas may have pre-filled ampules of saline that they can use to flush the catheter. Store the catheter in a clear plastic bag between uses to make sure it stays clean and dust-free.